Hello everyone, today in our video we're gonna understand the main steps that should be followed for reading chest x-ray part 2. How to read a chest x-ray? So initially to read chest x-ray we need to follow these steps. Firstly by checking the quality of chest x-ray, then by doing an assessment. So here we go with the first step, checking the quality of chest x-ray by using the RIPE technique, where the R is referred to rotation, the I for inspiration, the P for projection, and the E for exposure. So as we can see in this image, for checking rotation, the spinous process should be vertical. And in the second image, where the patient should do a good inspiratory effort. So the thoracic cavity stretches outward and separates pulmonary vessels, allowing for greater visualization of 5 to 6 anterior ribs or at least 9 posterior ribs. And also the costophrenic angle will be visible. And corresponding to projection, as I mentioned in the previous video, the chest x-ray may be taken anterior posteriorly or posterior anteriorly. And the final thing is exposure, where we need to see if the vertebrae are visible behind the heart. And in this image, we can see clearly all findings of RIPE technique. So I will give you some time to recap all. So for the assessment of chest x-ray, we use ABCDE technique, starting with A, which refers to the airway, where we should check if the trachea is visible, if it is central or deviated from the midline to one side. Then we can check the hilar regions, if there are any abnormal vessels or if any enlarged lymph nodes are present. Then we will check breathing by looking for lung markings if they extend completely to the edges of the lung fields, or if there are any abnormal thickness of pleural layers, or if there is any blood accumulation in the apical space. Then we should check the circulation or cardiac shadow, where we check heart size, which shouldn't occupy more than 50% of overall the thoracic window. And if it's more, then it will be a cardiomegaly. Then we should check the diaphragm, which is normally higher on the right side than the left side by 2 centimeters due to the liver presence. And also we should check if one of the costophrenic angles is not clearly seen due to fluid collection for case like emphysema. Then we can check the fluid or gas level if it is present on the left side in the gastric fundus region. And the final thing is that we should look for extra features like pace markers, piercings, some buttons on the shirt, or some artificial heart valves, or if there is any thick bony involvement like dislocated or fractured rib. And finally, the most important thing after reading the chest x-ray properly, you will need just to report back or just write down what you saw in the chest x-ray and highlight important positive findings. And thank you for watching. Hopefully this part helped you to more understand basics of chest x-ray.